If you have been to hospital today, you do know what I'm going to talk about. Labor unrest within the health sector is biting hard on patients and families as they resort to self-medication. Many patients since Monday have been left unattended to at various public health facilities across the country, even as government assures of resolving the impasse in the next 48 hours. Let's touch base with our correspondents. They have been assessing the impact of this strike on patients. We start with Northeast region, where Ilyasu Tanko is reporting. Ilyasu. I'm hopeful that you hear me, Ilyasu. What can you report from your region? How is this strike playing out in the Northeast region?
Well, as you said in the intro, the very, very biting in the Northeast region here. We do know that the region has been hit with floods, and residents are trapped in their communities, unable to move in and out. And these residents get sick and they go through thick and thin to move from their flooded communities to get to where the facilities are, or health facilities are, only to be turned away. This morning, I visited the Wulugu facility, and this facility cater for about 13 other communities. And the facility is closed since morning. I was there when patients came in. One patient coming from Kurugu with a baby who they told me was suffering stomach pain, and there was nobody to attend to this baby. An old woman also came there, and there was nobody to attend to her. One other woman also said she was suffering from BP, and she came to the facility. There was no single health professional or nurse there to attend to her, and all of them went back home. And they asked them what they were going to do now, and they said they were going to self-medicate. They were going to now rely on drugstores to get their prescriptions. In the Wale government hospital as well, yesterday we reported how a heavily pregnant woman was turned away. Today the situation remains the same. There are only 3 doctors at post. Yesterday the doctor at the female ward discharged all the patients there. Today the situation remains the same. Patients are still coming, and they are being turned away by authorities of these facilities.
Now that couldn't be any easy. Let's hear from the patients themselves who are living this, pain. And then we'll come back to you, Ilyasu. Hang on for me. But listen to some of the patients that Ilyasu has been interacting with.
So mamala BP.
I am a BP patient. I came for my regular treatment, and I am told the nurses are not being paid, so they are on strike. I don't know what to do next. I am going back to the house to treat myself.
So
Ankanaka Dr. Kamula Kayan.
I have body pains. I came to see a nurse, but I'm told they are on strike. I am going to the drugstore to get some medicine.
Very, elderly people who are having to live this pain. But Ilyasu, have authorities within your region put in any response at all?
Well, the only response that I got a call from the gentleman who introduced himself as the public relations officer of the Ghana Health Service in the region here. He called to inquire the whereabouts of the pregnant patient that we spoke to at the Wale Wale Government Hospital. And they said they were making a follow-up to find out her condition, whether she was able to get a hospital and what is happening to her. That there have not been any comment coming from authorities in the region here.
And have they found this pregnant woman?
Not at all. I mean, yesterday when we saw her, she was in a very desperate situation. The woman, the caretaker, had told me that she was 9 months pregnant and she was in labor. But unfortunately, the hospital authorities had to turn her away. And at the time that we were speaking to her, the one taking care of her told us they were stranded. They were now going out to speak to other family members and find a way to, send her to a facility because they were told to go to either Bolaga, Tamale, or Nalirgo. Unfortunately, at the time that we spoke to her, they were stranded, didn't know exactly what to do. So as to speak, we do not know the whereabouts of this particular pregnant patient.
Eliaso, thank you. We'll be talking to the striking nurses and we'll also be talking to the authorities to find out how we can actually resolve this and stop the pain that the people you've mentioned and those who have spoken to you are going through. But right now, let's go to the northern region capital, Tamale. Martina Bugri is joining me from there. Martina, what can you report?
Well, what I can report is that the strike is still on. Patients who came earlier today had to leave the Tamale Teaching Hospital because nobody was there to attend to them. The OPD that is normally choked and booming with activities on a working day, especially after a holiday, was eventually empty. Only 2 people were seated. And somebody I spoke to earlier said he had come from the Volta region. The mom had a tumor on the head, and so they were coming for a surgery today, but that had to be postponed because nobody was there to help. And the guy seems very dead. Mom was okay from the tumor, and so he was a bit confused. I also went into the wards. At the wards, I went to the emergency ward where they were not admitting new patients. What they were doing was that those who were on admission, they were treating them. But anybody who came in, no matter the extent of your illness or accident, you were not going to be attended to. Now, I went to the antenatal side where mostly women will come in for antenatal in the morning. The pregnant women were lined up, but there was nobody to attend to them.
Okay, Martina, you were breaking a little bit along the line. So just so I know that we heard you clearly, you have been checking from the OPD through the emergency ward to the antenatal ward, and you did not find people were being taken care of in these wards. You say that at the OPD, it's usually packed, but today you couldn't find people like that. And you say that someone had brought their mother from the Volta region with a tumor on the head. They could not get help for that. Where is that person at the moment?
Yes. At the time I was leaving the hospital, he was still there with the mom. The woman she just couldn't stand the pain. She had used a cloth to tie the whole head. And you could see her eventually in tears. I mean, the pain was so excruciating. You could feel it in her eyes, But they had nothing to do. He said they were going to hang on, hoping that the doctor would tell them something. But if that doesn't happen, it means that he would have to return to the Volta region with their mother again.
Martina, hang on for me. Let's listen to this person and we'll get back to Martina.
My mom has a tumor on the forehead. So we're asked to come back for review somewhere last month. Today is our 3rd time of coming here. But normally when we come by this time, the matter have already started. So we came over yesterday. We slept over here yesterday.
Where did you come from? From
Volta region, specifically Sugapope. But today it seems nothing is going on. So I'm confused. I don't know what is going on.
Have you spoken to any official? What have they been telling you?
Actually, I haven't spoken with any of them. And it seems nobody seems to care about what is going on.
How's your mom doing?
You know, the situation is getting worse. Initially when we came, it wasn't like this. But somewhere foregoing, she started bleeding from the spot. I don't know if someone can really help us in this situation.
What's your
First time coming here, so that's alright. So I can't tell why they are
What's wrong with you?
my eye. My eyes have been since last week, so I decided to come here. Like that's alright.
But you normally would meet people here when you come. Is that
Yes. But today I haven't met the people.
Martina, very disturbing stories, I must say, especially with a guy whose mother has the tumor. But where are the doctors?
The doctors are around, but who would lead you through the process to get to see the doctor? That is where the challenge is. And so when I spoke to one of the patients, he said that he was told that he can go with his folder. If the doctor says, okay, bring it in, I will attend to you myself, then he will be able to get treatment. If not, there is nothing they could do. Now, the northern region has a more challenging situation because you cannot count up to 5 well-equipped hospitals or health facilities which can take in these numbers. And so it means that several people who are sick now would have the big challenge seeking health care.
And that's very challenging, also because the Tamale Teaching Hospital doesn't just serve people within Tamale, but people in the Ashanti region, from parts of Techiman, etc. You've spoken to someone who came all the way from the Volta region. Are there other people who have traveled all the way to this region just to get health care and they're not getting?
Yes, I spoke to someone else who also came from the northeast region. He said he was referred from that hospital to the Tamale Teaching Hospital, and there was nobody to attend to him.
Martina, thank you very much. Martina Bugri is reporting from the northern regional capital of Tamale Teaching Hospital, to be precise. And as she puts it, there aren't well-equipped hospitals across in this particular region or in this particular area to help other people. And the Tamale Teaching Hospital attracts people all the way from Techiman, from the Ashanti region, etc. Let's get to Anas Sabit. He's joining us from Bono East region. Hello, Anas. Anas, I've spoken to Northeast region, I've spoken to Northern region. The story is that, in fact, if you look at the Northeast region, they've just had a recent flooding that's compounding the case. If you look at the the Tamale Teaching Hospital, it attracts people from outside the region. What is the story in the Bono East region?
The situation is same here. In Techiman, for instance, we have the Holy Family Hospital, which is a Catholic institution. We also have the Ahmadiyya Muslim Hospital, which is also a Muslim hospital. All these hospitals have been affected. When I go to the Ahmadiyya Muslim Hospital, the labor ward or the maternity ward was virtually empty. I had the opportunity to engage our authorities, and they referred most of the inpatients they were having by the weekend. They have to refer them to other private hospitals because there were no nurses on the grounds to help them take care of these patients. We also know that for the Ahmadiyya Muslim Hospital, out of the over 130 nurses and midwives they were having, none of them were around. So it is the pharmacists, the doctors, and then some officers at the finance department who were helping in taking care of the records of the patients who are in dire need, for the few doctors on the grounds to take care of them. So they have no choice but to refer to most of these patients outside. I have also had the opportunity to engage some of these patients. One woman, for instance, told me she will have no choice but to go home and then look up to God, because she did not have the financial muscle to pay for the bills when she gets to the private hospitals. So the situation is here. Those who have the financial muscle are okay to go to the private hospital.
Private hospitals.
The many we've engaged are saying you have to go home and then resort to self-medication and then look up to God and then see what happens.
What are authorities in the region saying, if they have at all?
Well, their call is on government to attend or to respond to the calls of these nurses, because they tell me without the nurses, there's no way they will be able to embark on their work as hospitals or as health facilities. For instance, when I go to the Holy Family, like I said, these are mission hospitals, so they have to do some internal arrangements to get people who are internally taken care of in terms of their payments. So these people were around to take care of the OPD services together with the doctors. I've also had the opportunity to go to other health centers in the rural areas, and that is where the situation is very, very terrible. Because
tell us about it.
I visited one community, which is Boyam, and the health center was closed down. I didn't meet anyone because those health centers do not have inpatients. They take care of the patients on a daily basis. They are nowhere closer to the hospital. So patients get there and they have to go home by themselves. So this is the situation from the little places we have visited so far.
Thank you very much. Anas Sabit is joining us from Bono East, where as he is reporting, some of the health centers are totally closed up. Let's get to the Volta region, find out what Ivy can report from the whole teaching hospital. Some patients were told are stranded. Ivy, give us more details.
So I went to the municipal hospital in Ho, as well as the Ho teaching hospital, where patients, especially at the municipal hospital, were asked to go back to other private hospitals because nurses were not there to help. When I got there at the Ho municipal hospital, I realized that at the OPD, there was no nurse. Even the doctor's rooms or consulting rooms, there was no sign of any nurse there. The Ho teaching hospital also had the same issue. Was a lot of patients were trooping in every minute to see doctors, yet no one was there. I spoke to one of the doctors in one of the hospitals who said he wanted to remain anonymous because of some security issues. He said that it was very worrying to see that nurses, even though they have issues, but it was really worrying to see nurses have interest in money more than human beings. He said he had to ask two of his nurses to stay back in the hospital and take care of some babies who are currently on oxygen and their mothers. And so he has to beg these nurses to stay back to help in that manner. So he is doing everything with other doctors there. So the situation is very patients there, and there is nothing they can do because nurses are not there to help, only the doctors. And so when they get there, they have to go to the private hospital. And those who don't have the money to go to the private hospital are stranded. So the situation is really, really bad.
Let's hear from some of the patients that Ivy has been talking to.
I came to the hospital around 9 o'clock. They knew they were on strike, but they took our folders and made us join a queue. I have just been told the nurses are not working. What do they expect us to do now? I am going back home.
Certainly a very worrying situation. Ivy, have authorities, and I'm talking about, say, municipal health authorities, metropolitan health authorities, whatever it is there is, have they responded in any way? Have they said anything?
No, right now, I'm not ready to speak for the info now. I'm sure they will want to speak later. Maybe the office will have to call them. We were not able to talk to any officials from the hospital or on camera, of course, or anyone from the regional directors or district directors. So no one is able to speak with that. But we only hope that by this evening or tomorrow, they are able to speak with us on the issue. But Gifty, seriously, the situation is really, really alarming.
Ivy, thank you very much for that update. Ivy Setoji has joined us from the Volta region, from where she is reporting that patients are stranded, and you heard one of them. Let's come down here to Accra, the Greater Accra Regional Hospital. Doctors there are picking up extra roles to contain the situation. Medical Director at the facility, Dr. Emmanuel Srofenyo, says the measure is unsustainable and wants government to promptly settle the issues with the striking nurses.
I said earlier on, the kind of situation we have now is not sustainable. So we are only pleading on government to bring their good offices to bear so that this strike is averted, so that it will not lead to any loss of life or loss of maybe increased morbidity. The kind of system we are running cannot be the way to go. It cannot be the routine. It cannot become the routine. It can't really go that far. It cannot be the routine, because then the doctors are being stretched. Let me give you one example. We have just about 150 doctors, but we have 700 nurses. And so when those 700 nurses are not there, the doctors cannot run their normal duty and then now come and take over the nursing functions. It is not possible, because looking at even the numbers, assuming they could do, but looking at the numbers that have gone away, that is this hospital alone, do you see? So even the figures alone should tell us that the situation cannot be the way to go into the future. So sooner or later, we are only pleading that government will come into some kind of solution with the feeding staff so that they can resume. Nurses are clinicians who are providing service at the front line. And so when you talk about the criticalness of the situation, this situation is more critical than the previous one. And so we are not praying for a similar situation that happened in the past, and that this thing will drag on for 2 months. It will really be a huge blow to the health system in this critical moment. Because the doctors are working, the hospital will not close down completely. We will sit down and devise systems that will enable us provide some service to the critically ill patients who need emergency services, like those who are involved in road traffic accident. We'll have to see to them. Those who have severe acute conditions that need immediate intervention, maybe surgical or medical treatment, we will have to take over. We will still have to provide systems to look after these people. But then healthcare will still be limited, because we will then have about 700 staffs who are no longer coming to the doorsteps, coming to the front line to provide service.
So that's the medical director of the Greater Accra Regional Hospital saying that this is a more critical situation than it is the previous industrial action that was taken by the nurses. He's hopeful that there will be some solution from government. You'll hear what the Deputy Health Minister has to say, but let's hear from some patients at this facility.
Okay, I'm coming here all the way from Amasaman through this heavy traffic to be here, and just to hear that only one doctor will be available after waiting about 3 or 4 hours now. Only one doctor, and if your case isn't that severe, maybe you don't have anything showing you should go home, then you have to wait and see just one doctor in this big hospital. So I'm just going to take my lab and return home, and my case too needs immediate attention, but per what's happening, I can't be here for the whole day, and I don't even think I'll see the doctor because the number is large here.
But you didn't know that the nurses were on strike?
No, I didn't know. I heard about it yesterday. I was here, but I thought because it was holiday, that's why the place was not quite active. But today, it's like it's active and there are no nurses. That's why I came, and I'm coming for my lab to see the doctor. I was scheduled on 22nd, and they are not there.
So what are you going to do?
Maybe I'll go home and see a private doctor, because they are saying, so we hear the nurses are back. and I don't know when.
Yesterday was holiday, so because of that, I should come on Tuesday. That is why I'm here this morning. So unfortunately, when I came for the lab test, I came so that the nurses would direct me to the doctor. But unfortunately, when I came, they said nurses are on strike. So because of that, if I'm having the lab report, I should go to the house, then wait till the day that nurses will resume back to work. Then I will come. And they said only those on critical cases can wait and then hold on. A doctor will come and then attend to them. That's what they told us. So I'm waiting. If the doctor come and then they will attend to me. No, please. I just want to hold on and then see whether I'll be able to see the doctor, because they told me to come on Tuesday because yesterday was a holiday.
If you don't see the doctor, what you do?
Oh, please, I'll go back to the house.
Coming from?
I'm coming from Mama Sama.
Mama Sama, okay, what are you going to do?
I'm going to come and look my child at Ridge Hospital.
Okay.
I've heard it, but the doctors are looking at us. They are looking after us, but we didn't see any nurse there.
So you want the nurses to come back?
Yes, we want them to come back. Thank you.
So you've heard from some of the patients at the Accra Regional Hospital. The Ministry of Employment and Labour Relations says it will be meeting the Ghana Registered Nurses and Midwives Association to continue their negotiations for their conditions of service, which is indeed the focal point for this industrial action. Speaking on Prime Morning on Joy Prime TV, Deputy Employment and Labour Relations Minister Bright Rekubrobe said his outfit is consulting the various stakeholders to pave way for successful negotiations.
Yesterday was a holiday, and this whole thing started on Saturday. We have been in discussions. Sunday, even yesterday, holiday, we were still talking. So today, my minister has called me. We have agreed on certain things. I have also called the Fair Wages and Salaries Commission Chief Executive. We are going to have a meeting. We will have a meeting, Ministry of Finance, Ministry of Health, and then we will write to them, possibly start engaging them from tomorrow. But I am praying that they respect the injunction order and ask their staff to go back to work. They should know that this government has been the most tolerant, and if they will agree with me, there are so many instances where we have had discussions, listened to them, their proposals that they bring. We have, reasoned with them, even had 3 or 4 sessions of meetings with the managers of their health facilities, trying to see the possibility of some of these allowances being paid by the health facility. So it is not as if we are reneging. We are not. The last thing we would want to see is what is probably starting to emerge. So I'm pleading with them to go back to work and come back to the negotiating table for us to continue to have constructive discussions.
Is it a little too late? Well, Mr. Rekubrobe is also accusing the nurses of refusing to respect the law.
A law that enables them to probably go out, pick taxis or sit in their own cars and drive, and the police escorting them and ensuring that there is peace, absolute peace in Ghana, is the same law that we are guided when it comes to labor issues. So when it comes to these matters and a body doesn't want to respect the laws which in the morning allowed him or her to go out in peace, then we are in trouble. It must not be so.
Is that what you feel the association is doing? They are not respecting the law?
Absolutely.
Which law are they not respecting, Mr. Rekubrobe?
They are not respecting it because once the injunction is secured, Labour Commission had to go to High Court and secure the injunction. It's also a process. When they were served the notice on Thursday or so, just look at the timing. Within 24 hours, Labour Commission had acted with the due process of law and secured an injunction. What is happening is that the service of this injunction notice must not only be done and served on the person, him or herself. These things can be done. There are processes. We even have substituted services. There are many, many ways which we will tell that this person has been served.
Deputy Employment and Labour Relations Minister there, Mr. Rekubrobe, speaking to Daniel Dazi on Prime Morning. Joining me right now for us to have an update on what the situation is as far as resolving this impasse is David Chum Tinkran. He's a General Secretary of the Ghana Registered Nurses and Midwifery Association. Mr. Tinkran, good afternoon and thank you very much for your time.
Good afternoon and thank you for having me.
Let's start with the injunction. Have you received that injunction from the NLC?
Not as we speak. And I'm surprised that the Deputy Minister's assertion is riddled with speculation. In fact, they should take nurses serious in this country. Okay? We are not people that will defy orders from the court. We are very law-abiding citizens. If you have a nurse in your family and he or she is really a nurse, you understand the way they conduct themselves. Of course, you may find some few people that conduct themselves in a manner that does not befit the profession. But what I want to say is that we have not been served any injunction.
Okay.
I'm not aware.
You're not aware of any injunction. The Labour Minister...
We have not been served with any injunction as I speak.
Very well. The Labour and Employment Minister, Deputy Minister, indicates that they have been engaging you and that there are negotiations ongoing. It looks as if you're showing bad faith because there are concerns that you can't continue to be on strike and be at the negotiation table at the same time.
When he says they've been engaging us, what exactly does it mean? We haven't taken any intransigent posturing. The belligerent posturing of the employer is what has brought us to this far. This is needless. It was avoidable. We spoke to some people at higher places, but they are so comfortable, all right? And they think that, as usual, nurses are full of women. We can treat them the way we want. These things that we are asking for should have been done 10 years ago, 20 years ago. Why should somebody who has completed university for maybe 20 years, has practiced nursing for 20 years, or 15 years or 30 years, be asking for rent allowance? What are you talking about in this country?
Mr. Zenkwa, I want us to deal with your demands holistically, because I want to ask you what the demands are so that you give me in bullets, one after the other, so every Ghanaian who is watching you can follow. But then I want you to deal with the issue about engagement. Are they engaging you or not? What did they tell you the last time you met?
The last time we met was Friday. They wrote us a letter. In that letter, the agenda of the meeting was to continue the negotiations. As humble and respectful as we are, and as law-abiding as we are, we went to the place because our employers are calling us. And we cannot say that. When we got there, we were asked virtually to explain ourselves why we are on strike. They wanted to interrogate us. They did not actually invite us to the negotiation table as the letter depicts. So we wanted to leave. But of course, they said we should have an informal discussion and see how best we can come to a certain amicable solution. But virtually, they invited us to explain ourselves why we have taken this course of action. An action we had already prompted them.
So this was last Friday. And you say the meeting was with who? NLC?
The meeting was with the negotiation table, not the...
I just want to know the particular...
The table. Not with National Labour Commission. We have never had any engagement with the National Labour Commission, except the fact that the Executive Secretary is all over saying that they've served us an injunction which has never been served.
Okay, so you never had a meeting with the NLC. I just wanted to find out who engaged you on Friday, who you said was interrogating you rather than negotiating.
Of course, we met the negotiating team, which was made up of the sector minister, the deputy minister of finance, the Fair Wages and Salaries Commission team. Basically, that's it.
Okay. Now let's look at the demands. I'm told, or I understand, you have about 9 of them. If you can give it to us bullet by bullet, if we can, summarize it a little. What are these demands you are asking for in this time, which you believe should have been, are long overdue, actually?
We're talking about rent allowance for nurses and midwives. You'll be surprised that the senior-most nurse in this country doesn't have rent allowance appearing on his or her payslip. Can you imagine? Having worked for almost 25 years after perhaps first degree and now maybe having a master's or a double master's or a PhD. All right, and that transcends down to the last person. We're asking for professional development allowance. Nursing is a skill acquisition program. All right, you develop your skill and you have to be knowledgeable as well. And there is something we call de-learning. Okay, when you don't practice what you have been taught for a long time, you will certainly forget it. So from time to time, you need to update your knowledge. I'm not talking about going to school. That is a different thing altogether. But in the course of your practice, you should be able to attend updates, in-service training and CPD points. Now, to be able to win CPD points, because you need that to be able to keep your PIN active so that you can be in the good books of the regulator, all right? Or the regulatory agency.
Yeah.
All these things cost for money. So if we are asking for a paltry percentage of our basic salary as professional development allowance, it's not something big. We are asking for fuel, asking for transportation allowance. Okay, the young nurses and midwives, they have to cross rivers, they have to, pick, of course, cars to work. They don't have cars on their own. Okay, they don't have means of transport. So if you're saying that give them a little amount of money to take truck and taxis and co, what's the big deal about it? I'm saying that all these we are asking for should have been done several years ago. We shouldn't be here at this time. It is very, very regrettable looking at how hospitals have been deserted. This is not what we want to see.
Yeah,
my heart bleeds.
You've ended at 3. Is that all you're asking? The rent allowance, professional development allowance, fuel/transportation allowance?
We are asking for a core allowance. Core-in allowance for physician assistants and certified registered anesthetists, midwife, and the rest of it. We're asking for book and research allowance. And mind you, the 8 items that we are asking is only 4 that will go to everybody. The rest of the 4 are specific, and it goes to certain specific skill mix within the profession. Okay. For instance, the book and research allowance is not going to every nurse or midwife or certified registered anesthetist. It's going to those who teach in our various nursing training colleges. We are asking for on-call allowance for certified registered anesthetists, for physician assistants, for those specialist nurses and midwives, critical care nurses, ophthalmic care nurses, ENT nurses. There are very few in the system. We were in Ghana when we decided to send a plane load of critical care nurses to Barbados. The few ones left are breaking their back, and we are asking a little amount of money to be given to them. How difficult is that? Okay. What we are asking for, I'm saying they are basic allowances that even my younger brother that I saw through university is collecting.
Okay. So from your perspective, the posturing of your employer says no to these demands.
Very belligerent, very intransigent, very belligerent. It appears as if we don't deserve what we are asking. And that is very unfortunate. That nurses, as usual, when we threaten them, when we intimidate them a little, they will continue to our pressure. How can you move to the High Court, secure an injunction at 5 p.m. and purport to have served on people on Friday evening? Do I stay at the office till 5 p.m.?
You feel they are threatening you?
So we are not available. As far as I'm concerned, we have not been served.
You feel?
Of course. If your employer calls you, to the negotiation table or writes you a letter ostensibly with an agenda to negotiate, and you get there and you are being interrogated. What is that supposed to mean? If a labor commission that has the powers of a high court, which is supposed to be an arbiter in impasses of this nature, move to the high courts without exercising its judicial powers, or if you like, move to a high court to secure injunction to be served on you at 5 p.m. What does that supposed to mean?
You see that as a threat.
It just intimidates you.
Okay. I want you to listen. Yeah, I want you to listen to the Deputy Health Minister, Dr. Okoboy. But before that, I want to take your quick reaction. We have been across the country with our correspondents who are telling us the effect of this strike. Someone has a tumor on the head. For several hours, she has had to go through the pain, and they've had to tie it with a cloth. A pregnant woman was turned away. It looks as if these people are being held to ransom. And I'm not saying you don't have a right to ask for the demands, but these people who are vulnerable, obviously, are being held at ransom. Well, how do you respond to people who think this way?
Well, I mean, they are entitled to their views, but who is holding them to ransom? It is nurses and midwives, certified registered anesthetists, and physician assistants who have withdrawn their services. The rest of the health workers are there. Why wouldn't they do what is expected of them? Why wouldn't they do what is required by their training for these people? Who is holding who to ransom? We are not holding anybody to ransom.
The thought is that without the nurses... Yeah, that's fair. That's fair, actually. The thought is that without the nurses, it's difficult for the doctors to process these patients who are coming through. And so, essentially, healthcare is at a standstill and people are suffering. How does that make you feel, personally?
It's unfortunate. I'm saying that we shouldn't have got into this place at all. This was purely avoidable if it wasn't the intransigent, belligerent posturing of the employer and its agents. As far as I'm concerned, this was purely avoidable. It's unnecessary for nurses to go on strike. But look, we were pressed to the wall, and we can certainly not go through the wall. We have to bounce back, and this is the result of we bouncing back after hitting the wall.
We'll get to talk about bouncing back and the way towards that bounce. But the Deputy Health Minister, Dr. Okoboy, is confident that between you'll be able to resolve these concerns in the next 48 hours. Well, according to him, government has already been looking into the condition of service for nurses and midwives for you anyway, and there hasn't been any challenge implementing them. He wants you, the nurses, to call off the strike and return to the negotiation table. I want you to listen to him. When I return, we'll talk about the way forward.
The last time I checked, I think the ministry, because we couldn't get to common grounds, brought in the Labour Commission. And you know our laws allow the Labour Commission to be the arbitrator. The Labour Commission went to court to get an injunction, not an injunction that disrespects their concerns, but an injunction that will give them more space so that they can negotiate. Whatever the concerns that are there, it will take talk to resolve them. So all the court did was that I've given you 10 days. The injunction is not ad infinitum. It's specific. 10 days to engage. And apparently the last time I checked, their leader said, well, they've not gotten the service. I only appeal to them that this particular application injunction is around. They should try and get to the table. And we are committed to helping them. Look, if this government were not committed, there is no way in the middle of a pandemic, when inflows have gotten down in every country in the world, there's no way we would have given them tax exemptions. We have exempted every health worker in this country, including nurses, from paying income tax. Teachers are paying income tax. Soldiers are paying income tax. Policemen are paying income tax. Akufo-Addo says no health workers should pay income tax, from the mortuary to the security man at the gate. So that is a sign of compassion and support and an appreciation for the work they do. We've given clearance for over 90,000 health workers in 3.5 years. Never in the history of this country. All nurses who were at home have been cleared by this government. The few who have not been captured are on NAPCO. Before Nana became president, all these nurses were at home, having no experience, nothing to take care of themselves. So Akufo-Addo has demonstrated that he has a big heart for all citizens. And I'll plead with them to look at that particular gesture and come to the table.
But how soon do you expect to reach a consensus?
In the next 48 hours, I am optimistic that we will get a solution. I thank you.
That's a Deputy Health Minister, Dr. Okoboy. Mr. Tinkrine, how do you respond to that?
Well, he's expressed his opinion. He's entitled to it. What does employing 90,000 health workers got to do with condition of service of nurses and midwives? We are making reasonable demands. If they are minded, they should meet us halfway. We will go back to the world and do what we love doing. I don't want to follow those things and those politicking. If you have employed 90,000 healthcare workers, what does that got to do with the service condition of a nurse or a midwife?
What about the point he makes about tax exemptions, for example, for health workers? He says it's a sign of good faith that they are committed. This government, I should say, is committed to taking care of, nurses and doctors, people within the healthcare delivery system.
The tax component is a percentage of a basic salary. He's a medical doctor. Whatever he finds on his payslip, he's entitled to it because he merits it. We are asking for a paltry percentages for nurses and midwives. He should respect that tax incentive. So the smaller your salary, the smaller or the lower that tax he's talking about. How much was that tax incentive? Yes, of course. It's a good thing. I commended the government variously when it was done. But that is not a reason why it should hold us to ransom with respect to our condition of service demands.
Very well. I tell you what, hang on for me.
He has a very juicy condition of service. He should enjoy it. He should enjoy it. You're asking something paltry for nurses and midwives, and that's what we're asking.
Hang on for me. We just the Deputy Employment Minister says he has an intervention here. Let's quickly hear him. Mr. Akuprobe, thank you for your time this afternoon and for calling into the show. What is this intervention? Please go ahead.
Gifty, thank you very much. I think that it is important that we try to correct some of these things that our health leaders would want to put up, largely because we are not in normal times. And it appears as if one is doing a bidding which is courting the general public against the other. And you will agree with me that this is not a government that merits that kind of thing.
Just a quick one, Mr. Probe. You indicated that you want to clarify a few things that they have said, I believe. Yes, what's this clarification?
What I wanted to clarify is that I have 10 requests on my table, and we have almost acceded to all of them and met them, except probably for the fuel and then the rent. And you will agree with me that matters of rent in all institutions, there's nowhere rent is paid across board, and rent is being paid to some category of staff. And this is the discussion which we are with them. Similarly, the same thing applies to fuel. All the rest that they have said, we have met them. The only point in discussion is that some of them, let us go back, let us do the calculations, and then come back to table. At the last engagement, they were given 4 weeks so that we will go and plan this. This includes one, the uniform which they talked about. If government decides to probably agree to the uniform, no problem, we will agree. But
hang on, Mr. Akuprobe. When you say uniform, you mean the uniform implementation of the request they are making?
No, they requested for uniform allowance.
As in, okay.
Yes, uniform allowance, as in the green and the white which they put on.
Right.
So, and they wanted 10% of their basic. And I'm saying that we have met them. We've agreed that that's no problem. We cannot put that on your payroll, but then we will do the calculation, and then at the end or beginning of the year, we pay it as one-off. So these things have been agreed. Professional development allowance, the non-basic core. All of these things have been agreed.
Except
a sign of good faith.
Except fuel and rent allowance and the uniform allowance, which you will not put on the payroll, but will have a sort of side agreement to pay.
Exactly, and even book and research allowance, which we have also agreed that we will give to the degree awarding institutions, just like we do to those in the universities, the lecturers.
Okay. All right, let me just, Mr. Tinkwan, you've heard this. This looks like some positive way forward. What is the way forward for you, really? It seems you are muted, Mr. Tinkwan.
I wish the deputy minister was at the negotiation table. If he says we have agreed, we have agreed. He agreed with who? To what? What we are saying is very simple. Look, most of the things, they are asking us to go to the facility. They want to burden the IGF, internally generated fund. And we are saying that that is not sustainable. The 2016 condition of service that expired in 2018. Everything in there was agreed, but go to the facility to pick it up. And it never worked. So we have agreed. He's saying that what? Book and research allowance to degree awarding institutions. It has been agreed by who and who. They said they should go to the facility to pick the money. And we are saying that we will not accept such a thing. So that is their position. In fact, he's actually talking about their position, not an agreed position.
Okay.
All right. Of course, we brought a proposal, and then they also brought a counter proposal. So everything that he alluded to are their proposal. Because
not
we
an agreement.
Said variously, not agreement. We have said that telling us to go back to the facility to pick those things that we have requested for from internally generated fund is not going to work.
It's not going to work for it.
2 years ago, the same thing happened, and we did not benefit.
Okay, so 2 years ago, the same thing happened. Mr. Akubo, but the point he's making is that this has happened before. And he's saying that what you are proposing has not been agreed upon. And it says to put pressure on the internally generated funds, and that will not work for them.
Gifty, the way forward is not to go on strike. As he clearly alluded, we are talking. We are talking.
But Mr. Rakubebe, hang on, Mr. Rakubebe, you indicated to us that there has been some agreements which, put some of us at ease. But apparently it hasn't been agreed upon. It is a proposal, a counter proposal that you brought to their proposal. So it is not an agreement, first of all. Secondly, please let me land. Please let me land, sir. So that's the first one. The second point they make is that I'm just listing it for you, sir.
I disagree with you totally.
Okay, hang on, sir. I'm just putting this to you so that you respond to it. So you get to respond. What I'm saying is that from what I'm hearing from the side of the nurses, they have not agreed on anything with you as yet. Secondly, they say that this has happened 2 years ago, so it's like something they've gone through before. So they are at a place where it's very familiar, and government has not lived up to its to expectation. So please come in with the response, sir.
Gifty.
Yes, sir.
I would wish that you found out from them which of these things that they tabled that we both have agreed.
You want me to ask them which ones you've agreed upon?
Yes.
Okay. Mr. Tinkwa, is there anything that you've agreed upon at all?
Of course.
Okay.
There are a few things that we have agreed upon.
Right.
One is the 8% non-basic allowance.
Looks like I've lost him. We'll try and
First April 2021. Back and forth, they agreed that they will peg it at October, and then the arrears will be deferred to next year. We said fine. We tabled uniform allowance. They said they won't pay it monthly. They'll pay it one-off. We have agreed to that. Basically, these are the only two things that we have agreed.
Okay, so there has been some agreement at least.
Exactly. There has been some agreement, and we keep talking.
Okay.
So the point I'm making is that we have not gotten to
Mr. Okubo, you just interrupted his points. Let him make his point. We'll come to you.
We cannot table 8 items, and they will agree to 6 and we will proceed to strike. We are not stupid. What are you saying?
Okay.
We are very we are very reasonable people.
Gentlemen, at the end of the day, Mr. Tinkran, I've run out of time, but at the end of the day, it is a pregnant woman in the northern region who is suffering and on the verge of losing their child. It is the woman who has traveled all the way from the Volta region to Tamale with a tumor on the head who stands at the risk of dying. What do we do going forward? The people of Ghana deserve better.
We shouldn't have gotten to this point. You don't blame the nurse.
Can you come to a compromise for the sake of the people who may die?
No problem. We have been invited by what's the name? Labor Commission. Tomorrow we will go. All right. And if the injunction is properly served, we will go by the dictates of the law. I've told you already that nurses are very responsible and rational human beings.
Okay.
We will not go against the law.
Mr.
But they will not treat us for a ride.
Okay. Mr. Tinkran, I say a very big thanks to you, and I'm very hopeful, very, very hopeful, that in the next 48 hours or even 24 hours, a pregnant woman won't feel like they're going to lose their child and probably lose a child, and a woman won't die, a man won't die because nurses are unhappy. And Mr. Bobe, thank you for your intervention, but what really can you also get to a compromise on with these nurses so that we can end this? Nobody is benefiting from this at all.
Yes, I'm happy the representative of the nurses are now acceding that tomorrow, God willing, he will come to the Labour Commission. So we are happy to be at the Labour Commission, resolve this matter. It is not our wish that we even have this banter on air.
Yeah.
Not at all.
It shouldn't be. But the point is that they feel that government
and the poor pregnant woman is getting what she
deserves. Mr. Bobe, I just want to make this point, though, that the point they've made is the feeling that government over the years have taken them for granted, and he keeps making that point. So hopefully at the next meeting, that won't, be the situation.
If we take our word, this is not a government that takes them for granted. All our engagements, we have initiated it. So, you should know that all the meetings we have had with them is at the instance of government. This is a government so sensitive to health workers, and we will not sit down and let them deteriorate at all.
Mr. Bobe, thank you very much for calling into the show. Mr. Bobe is the Deputy Labour and Employment Minister who had called in to put in a few clarifications. You also earlier had David Chum Tinkran, who speaks for the Registered Nurses and Midwifery Association. It's been a lot of back and forth. Mr. Tinkran, thank you so much for your time. I'm looking forward to great news tomorrow, and I'm very hopeful that we'll get that and we'll hear it here on the show. You're still watching The Pulse with me, Gifty Andor-Pia. And if you have to go to the hospital, I hope that you get some help. But if not, you can try the private hospitals. Hopefully you get help there. But by tomorrow, we hope things will get better. Do stay with us. I'll be right back. I'll tell you about another worrying situation. Accidents. We've had so many of them in the last 2 weeks already, claiming about 30 lives. We'll talk about that when we return. Do stay with us.